Apologies.
All right. Good morning, everyone. For those of you who did not hear that, we are going to go ahead and call the meeting to order at 10:31. A big thank you to everyone who's here in person for today's meeting. For those of you who are online, we have a very nice attendance here in person today. Please bear with us as we are having a little bit of audio issues. We are passing around my cell phone and I'm getting in my steps this morning, but it is working. We'll go ahead and do roll call, Shelley.
Brian Smith.
Present.
Brian Stevens. Your audio. Chris Salvino.
I'm on Zoom or Teams.
Dale Woolridge. Daniel Spate.
Dan Spate here by phone.
Oh, thank you. Deb Garambe.
Present by Zoom or Teams.
Edgar Bissonette. Franco Castromarin.
Present.
Gail Bradley.
Present.
Garth Gamer.
Present.
Gina Shira. Glenn Kaspersick.
Present virtually.
Heather Miller.
Present.
Eve Godstanker.
Present online.
Jesse Torres. Jonathan Madam.
Present.
Nick Ells. Raymond Ochoa.
Thank you.
Rodney Reed.
Present on Google Meet.
Roy Riles.
Present virtually.
Sarah Parati.
Present.
Oh, thank you. Shari Brand.
Present online.
Stevie Merrill.
I'm here.
Todd Hermio. Vince Martinez. And Vivian Gellert. I count 20. We have quorum.
All right, thank you. If we did not capture your attendance online, please let us know and we will make sure we capture that. Excuse me. In your packet, there is an attendance report. Just a reminder that if you missed 2 or more consecutive meetings, Shelley will reach out to you to determine if you would like to still participate in the committee. We have several current vacancies on the committee. These are listed on the agenda. We have 3 public member vacancies, an ambulance service corporation representative, and a physician specializing in emergency medicine from the local EMS coordinating center, Western region. These are all governor appointed positions. If you are interested in applying, the link to do so is on the agenda. Just a reminder that this meeting is being recorded, so everything said or shared as part of this meeting is posted to the Bureau's website and is part of the permanent recording for the meeting as well. I wanted to take a moment to recognize that May is Trauma Awareness Month. We will have a slide for this. In addition, we are also recognizing EMS Week, which is May 18th to 24th, and we will get to a slide to recognize that as well. I will turn it over to Nicole to start the Bureau updates.
You're back.
Just go start with Nicole's slide.
Okay, so good morning, everyone. Just our staffing updates. So we just want to offer congratulations and acknowledgement to Lehia Castro, who's in the back. If you're in the room, she can raise her hand, and I think you'll be hearing from her later on her promotion to our certification manager. Lehia has been with the Bureau for some time, so many of you may already be familiar with her, but we're happy to have her in this role, and she's already done some amazing things, as well as Brent Caswell, who we've confirmed is our enforcement program manager. He has been acting in this role for a little while, so we're very happy that he decided he still wanted to stick with us as the permanent manager, and so congratulations to both of them on their promotions. We also wanted to welcome Stephanie Cotright. She's our new CON administrator. So in our last meeting, we've given a litany of vacancies. So now we're happy to say, provide some of the names to some of those vacancies. Mitch Adair and Lance Bevins both are new enforcement investigators with the Bureau. They previously have worked with the agency and with the Bureau, so you likely remember their names. And so we're happy to have them as part of the team permanently, as well as Monica Ritchie, who is waving in the back if you're in the room, and she's our new Trauma Center Compliance Officer. So I'm really excited to have her join our team as well. Lastly, we do still, it's not on here, but we do still have a vacancy for our Bureau Chief for EMS and Trauma System. That is an open recruitment still. And so all of our jobs with ADHS you can find on our azstatejobs.gov. Certainly, if you have folks that are qualified or interested in that role, please continue to send them our way. And hopefully we'll be able to bring you some good news on that vacancy in the future as well.
Thank you. All right, Shelley, if we can go back to those first few slides, please. Thank you. So I just wanted to go ahead and recognize that it is Trauma Awareness Month. We did recognize this earlier this morning during STAB, and also awarded a number of trauma awards that were selected by a committee external to the Bureau. So big thank you to all of our trauma centers and all of our personnel that provide care to the citizens of Arizona. And definitely wanted to mention, especially for EMS Council, that the National EMS Week is May 18th through 24th. As you can see here, each day has a specific theme, including education, EMS safety, EMS for children, Save a Life Day, and EMS Recognition Day. I just personally wanted to thank everyone for all your work that you do in terms of supporting the citizens of Arizona. Working in the pre-hospital environment is a really challenging environment to work in. And I just wanted to say a big thank you to all of your personnel and your agencies for the work that you do for the state. And this is a proclamation for Trauma Awareness Month and EMS Week, as well as EMS for Children Day from the governor. So thank you to Governor Hobbs for this proclamation on behalf of the state, and recognizing everyone for their care that is provided to the citizens of Arizona. All right, Carissa, are you online for?
Yes, I am. Okay, so as most of you know, we've migrated, or we have started using our new trauma registry system as of January 1st. I've gone through a lot of these changes, or a lot of these points already, but the new one that we want to point out is that we're having an in-person training this month. It'll be May 28th and May 29th. So the 28th is going to be for the full data set facilities, and the 29th is going to be for the reduced data set facilities. So it'll be at Honor Health Osborne. So thank you to Honor Health Osborne for being willing to host. It'll be from about 9 to 4, and I have an agenda that I'm going to be sending out soon. We'd love to have as many people as possible in person, but if you're unable to attend, there will be a virtual option, and I'll be sending out that link as well. If anyone has any questions, feel free to reach out to me. And I think that pretty much covers it for me.
Thank you, Carissa. All right.
Okay, so the EMS for Children program developed late last year some pediatric emergency care coordinator role guides for both the EMS agency as well as hospital. Oh, yes. Am I too quiet? Yes. Testing. Tried to yell, guys. So to just reiterate, EMS for Children developed some pediatric emergency care coordinator role guides for both the EMS setting as well as hospital setting. These are designed for anyone that's serving in pediatric leadership roles within your agency or department currently. We wanted to provide some guidance from both nationally recommended guidelines as well as state guidelines for what a pediatric emergency care coordinator should be. That QR code will send you to a link. If you're interested in learning more about this role, just please feel free to reach out or scan that QR code. And then next slide, Shelley. Okay. So this is very pertinent to bring up during this committee or council meeting, because you are the individuals that approved this program originally last year. So we've come full circle. So Making Arizona Ready for Kids is a pre-hospital pediatric recognition program, and we're honored to recognize 6 agencies that demonstrate excellence in pediatric emergency care today. First, we'd like to highlight Arizona Fire and Medical Authority. We also have Central Arizona Fire and Medical Authority, and I believe Chief Dominski is in here today, so we'll give a round of applause for him at the end. We also recognize Gila River Emergency Medical Services, Lifeline Ambulance Services, Maricopa Fire and Medical Department, and Porco Valley Fire District. These agencies went through an extensive review process, as well as giving us better insight in what they're doing for training, education, and helping their community within pediatrics. So again, we're honored to recognize them today and for the next 2 years and support them in this role. So we could just have a round of applause for them, please.
All right, thank you very much. Next, we wanted to just briefly cover the scope of practice updates and drug table updates. Just a reminder that these did go live January 1st of 2025. As this is a substantial change for the state of Arizona, we are doing our best to make sure that we really share this information across the calendar year. Reminder that we did approve the addition of both EMR and critical care endorsement to the scope of practice for the state of Arizona. And so this was a pretty large enhancement to the overall scope of practice for all levels. So EMR, EMT, AEMT, paramedic, and critical care endorsement. In regards to the drug tables, those were updated with the increase now of the critical care endorsement. There are a large number of medications which have been added to the drug tables specifically for those paramedics with that higher level of training and education. And then we also adjusted the hospital-based paramedic drug table to really reflect what they do in the hospital facility. So more option for oral medications as well as topical agents. The Bureau does get quite a few questions about this. And so we wanted to make sure that we continue to share this information. If you go to the Bureau's main billhorn at the top at the website, you'll see a link to all this information. So if you need that, those are readily available for download as well. All right, now I'll hand it over to Julia next.
All right, thank you, Dr. Bradley. Just a quick update on the strategic plan. As you are all aware, we completed the development of our strategic plan last year and brought that to the September EMS Council meeting. It's currently with the Governor's Office for review, so we're still waiting to see if we receive any feedback on that. Currently, the Bureau is working on setting up internal and or external work group for each of the priority areas, depending on what the needs are for each area. We will continue to provide progress updates at each of the standing and statutory committee meetings. So today, just a couple of updates for time-sensitive illness and injury. We're continuing to work on processes related to the SHARE program, as Adam will talk about a little bit later. We're working on increasing the number of EMS agencies participating in the naloxone leave behind and currently have up to 59 agencies. For registries, data, and reporting, we have chosen our new trauma registry vendor. We're working on tasks related to that, and then also have completed updating our dashboards. And then for financial instability and resource needs, we're continuing to monitor the budget and look at the budget narrative for this upcoming fiscal year. And then workforce development and training, as Dr. Bradley just discussed, we have continued to circulate the critical care career pathway information. That concludes my update for today.
All right, thank you. All right, Lihia, I think you are up next here. Just give us 1 second as Lihia comes up to the microphone.
Good morning, everyone. So a few of updates from the EMTT team. We have created an eligibility questionnaire for all the initial applications. You can find that application. You can find that questionnaire on the main ADHS website on NEMA's trend before you log in. And then actually when you're completing your NREMT verification form, it's just like 6 questions, yes or no questions. Like if you have everything that's required, do you have your NREMT? Is it up to date? Do you have your do you have an Arizona state address and all, like everything that's pretty much required for your MCT? You can find those. We're going to be working on creating some for the renewal application for the critical care endorsement for the applications that we have pretty much. So that should be coming up soon. Also, when we have those, because we want to make sure everyone completes their application and we want to help everyone, just making sure we have you have everything that you need to. If you have any criminal question, if you have any criminal history or conviction question, please reach out to us as well. We have the information there because we want to help you move the application along. And if you have any questions, again, please let us know. When you're submitting the applications, make sure your NREMT is up to date. There's some glitches in the system. So sometimes, like if your NREMT is expired, you'll still have access to the initial application. but we're still gonna check that regardless. So just to speed up the process, make sure it's up to date. And then also make sure you have an Arizona state address so we can process the application. If you're renewing your certification, you will have access to the application 90 days prior to your expiration date. So you'll have plenty of time. You'll be getting your reminder emails. I believe it's 90 days, 60 days, 30 days, and then I believe it's like 24 hours before expiration. So just make sure you keep an eye out on those. And then just a reminder, if there was a change in your name, you have to let us know within 30 days. We have an application for that. If there's any criminal conviction or any changes to your certification, you have to let us know within 10 days of that happening. And yeah, we have a new email for our certification team that you can email us. It's emct.ems.at.acdhs.gov. Usually myself and Kathleen, we're checking up on that regularly. And then you can also call us. Daniel is the one that answers the phones. But you can also call me, or you can also call Kathleen with any questions that you have.
Thank you. And one of the things we are trying to make sure we get out there, as there is a plan to try to grow the EMS workforce, we recognize that many fire departments are now starting to include the EMT training as part of their fire academy. Historically, when people had their EMT certification first and then got hired through the fire academy, their certification was in place. But just wanted to make sure as you start recruiting individuals that if you do the EMT class as part of their fire academy, you want to make sure that they are eligible for certification. So kind of working through that process early, just to make sure that there aren't any glitches. We know it's a big commitment for the individual as well as the agency. So just putting that information out there. If you have any questions about eligibility, that's where Lihia and her team can really help. Sometimes these are things in terms of simply a timing issue, but really want to make sure as we were trying to really grow the workforce, we do see that there's been a little bit of a transition of how people are being hired on. So they want to make sure we mention that, and we're trying to put as much information forward facing on the Bureau's website to help applicants, and then also be available for questions before that starts. Yes, Todd.
Thanks, Dr. Valley. My question was on the address for applicants. You had mentioned an Arizona address. That may be a hindrance for folks that are maybe, I'll call it dual certified in multiple states or some of our rural areas or border areas. Has that been considered, or does it require an Arizona license or address? Okay. So just to make sure, going back to I'll call it our employees, they can use the address associated with. Copy. Okay, thank you. Just want to make sure.
Yes.
Just thought I'd line up here. I think it's useful to point out to your EMCTs that this is a body of rule that requires them to make reports to the Bureau. This isn't a requirement of the agency or the medical director, but in reality, I think it behooves agencies and medical directors to tell their people that this is indeed in rule. And if you run afoul of any of these things, you need to let your agency know, and at least we can direct them on how to make the proper report. Thank you.
Thank you. All right, this is just a list of the trauma award winners. So big congratulations to all those awardees. Just wanted to mention, as I did mention in the previous meeting, thank you to the committee that also volunteered their time to review the nominees. As the Department of Health Services, we are not the agency that is actually reviewing the applicants, but thank you to everyone who nominated individuals and to the committee who took the time to review them. Really nice to be able to recognize people. As regulators, we don't often get to give good news, so it's nice when we get to take some time to actually recognize all the work that you do for the community out there. So thank you very much, and congratulations to all those awardees. And we will come back to this list in a little bit more detail shortly. All right. Next, I will cover the naloxone leave behind program. As you can see here, our numbers are really impressive. So we have over 4,200 personnel who are trained in naloxone leave behind. Just to give you a little bit of information on that, that is over 25% of all the EMTs and paramedics in the state of Arizona are currently trained in naloxone leave behind. This is really a fundamental change that I don't think anticipated these numbers when we started the program, got the grant. There is a lot of data that shows that getting naloxone out there in the community not only saves people's lives, but also helps people enter recovery. It demonstrates that you have empathy and want to help that individual. And so we really appreciate all the agencies, the medical directors, and the personnel that have taken the time to get engaged in this program. We have 59 current agencies in the state of Arizona that are participating, and a really nice split between urban and rural. So thank you to Dave Hansen, who's added that information to the slide deck as well. We have shipped out over 5,000 kits. And over 1,000 kits have been scanned. So we're at 20% of all kits are getting scanned. A reminder to your personnel, if you see on the picture in the slide, there's a red bag at the bottom. That's where all the information is placed in. There's a QR code for the individual to scan when they give the kit out. The QR code is the same across all kits. So if your personnel accidentally give a kit out to someone and they forget to scan that kit, it doesn't matter. They can go back and scan another kit the agency has. We collect very limited information as part of the grant. We really just want to know your agency and the zip code of where this was given out. That allows us to restock you, but also to gain a little bit of data about where in the community in the state of Arizona we are giving these kits. So a big thank you to everyone's commitment to helping you grow this program. Next, I wanted to cover very briefly EMS and trauma data dashboards. These have been updated through 2024 for EMS and 2023 for trauma data. I wanted to really recognize Vatsal and her team for the amount of work that goes into the production of these reports and these dashboards. This slide deck will go out after the meeting, and you'll have the hyperlinks to be able to click on those. The amount of data in there is really impressive, and thank you to the agencies that submit your data via AZ Peers, as well as the trauma registry. We have information that you can query for pediatric specifics, geriatrics, all age groups. You can query by county, by region. And we do know that there's a number of prevention efforts that are done based on this. And really, we've seen across the state of Arizona some rather large grants that have been awarded based on data that the agencies have used from these dashboards. So if you have any questions on how to find something on there, Vatsal or her team can help you with that. But just wanted to say thank you to everyone who sends data to the state and to our team who puts these reports together. And for those of you that know Angie McNamara, so Angie will be retiring after 23 years. So really monumental. Many of you, I'm sure, have worked with Angie at some point or encountered her. And so we are going to have a little recognition for her on June 26th at 1 p.m. It is open to anyone that would like to stop by to recognize Angie. But I wanted to make sure that I mentioned that as part of this. So thank you and congratulations to Angie. And then May is Motorcycle Safety Awareness Month. Just a reminder about the safety and the injuries associated with motorcycle crashes. So being aware of the motorcyclists around you. And that is it for that component. I think we may have skipped the share part. Are we going to come back to that one?
Share,
Okay.
for item E. Yeah, so hi everybody, this is Adam. If you're online, and I'm Adam if you're in the room. This is for the share program. So in past years, the team at the University of Arizona would make heroic efforts to match hundreds, if not thousands, of cases of cardiac arrest, out of hospital cardiac arrest from EMS and hospitals. Since we took that program over, we gained a deep understanding and a deep appreciation of the work that they put into that. And so since taking over the program, it seemed to be a natural course to attempt to modernize the share registry, the cardiac arrest registry, and we're doing that in a couple of ways. The first of which is pretty significant. Perhaps less heroically, we are automating that case matching process using artificial intelligence, and it's directed by the same team that's putting out these your dashboards that we all enjoy, so we can expect a similar quality product. So we're very excited about that. So automated case matching is going to help the program's longevity and the program's ability to turn data back around pretty quickly. And then the second modernization initiative is to align ourselves with the CARES national schema, cardiac arrest national schema. Not that we're taking on CARES as a product and a software, but we're gonna match the same questions that they ask in their cardiac arrest registries, so that we can be considered in the national schema, while sidestepping some of the financial implications of going to a large system like that. So those are two major efforts. Last, though, I apologize for not actually producing the share report. We've made major steps toward producing the report, but we haven't been able to actually produce the report itself. And I know many of you have asked for that. Many stakeholders are asking me for that. And it will be a great day for me to be able to share that report with you. And we're excited to see where the program goes from there. If you have any questions about the SHARE program, please feel free to email me.
Thank you, Adam. And I just wanted to add on in regards to what Adam has mentioned with the SHARE program. This has been a really large undertaking, and part of this undertaking is to modernize our data set. So fortunately, with the NEMSIS 3.5 conversion, I think almost 2 years ago now, all of the data for the SHARE program and CARES at a national level has all been made kind of into your data platform. So anyone who has a NEMSIS 3.5 compliant vendor for your EPCR system, all of your data is going to report automatically and be the appropriate data for EMS. The big change that we're looking to improve is on the hospital side. The original data set was really a very large data set and was manual. So for the hospital perspective, they have to manually enter every single cardiac arrest patient with a number of data variables. Part of this modernization is trying to streamline the number of variables, which we have down. We're just trying to work out the funding piece to be able to make that conversion over. But I think once we do that, it will be a huge plus for the entire SHARE program and really a big win for the hospitals. It will be a very reduced data set. It will match the national standard for CARES. When you look at Arizona and the SHARE program, SHARE in the state of Arizona and CARES really started at the same time. And we've been able to maintain our program here within the state of Arizona. We know that Arizona became a leader in out-of-hospital cardiac arrest survival, and that was specifically as a result of the SHARE program and the data that we got from EMS agencies as well as the hospitals. So we appreciate everyone's patience as we do this conversion. I think the new product will be a much improved one, and it'll be a huge benefit. And really, as Adam mentioned, it was a big lift to try to realize all of the manual labor that the U of A did for many years, and now just trying to make this a more automated process with the newer technology. So thank you to everyone's patience. But again, I do think this will be a big win moving forward as we make this conversion. All right. I know that Anne has a presentation on the updates to the Premier EMS Agency Program and cardiac arrest data variables. I'll turn it over to you, Anne.
Good morning, everybody. And that answered my question if Shelley could access my presentation. Okay, great. So I'm just going to go over a few of the key pieces and background of the report, and then I'll show some snapshots of what it looks like. We've already had one report go out. It was it covered the first quarter of the year 2025, and then from now on it will be a monthly report. So the purpose of this PEEP data quality report, and just in general having the PEEP SHARE data quality initiative, is to improve the data that SHARE receives from pre-hospital database. And the report population, so the report contents, only includes out-of-hospital cardiac arrest patients. It doesn't include any other kind of incident or patient, like the other data quality reports that agencies receive. And the additional requirements became effective for PEEP January 1st of this year. And as I said, I think it was around the 15th of April, we sent out quarter one, just as like a whole quarter together, but from now on it will be month by month, sent out somewhere between the 1st and the 15th. I haven't figured that out yet. And it will just represent the previous 1 month. And the target median score, which you'll see kind of clips of it later, is the same exact requirement as it is for PEEP overall, which is the greater or equal to a score of 90 for a median. This just keeps everything the same and hopefully reduces confusion on what is required for what. Next slide, please. And just in case you need a refresher, these are the specific data elements for the portions of the report where we're targeting specifically data points that should be filled in as far as our validator can tell on each EPCR, and highlighting any potential validation issues. They're targeting these data elements. Next slide, please. Okay, so how are agencies supposed to use this report? So when we send out those reports, and like I said, I'll show you some clips of the actual report that or a mock-up of the report we did. They should review the number of out-of-hospital cardiac arrests. They should look at the overall data quality metrics, of the because it's actually 3 reports in one, and kind of see how they're doing for that previous month. And then they'll be able to address, and they should address, specific validation issues that they can find in that report to determine how improvements can be made, and that they can go back and improve those previous EPCRs and have them resent, or they can just use it to discover where the issues are and update, either their rules, or perhaps the element isn't even being sent, even though they're collecting it for the next month. So it will be reflected in the next month's report. And the report has 3 sections, which I'll show you in a moment. There is a summary of out-of-hospital cardiac arrest calls, including total calls and a data quality median metric. And so agencies should really ask themselves, does that number that we're telling you we have for that previous month, does that match your own total? Because if it doesn't, then it either means we didn't get that EPCR, or it didn't meet the population for cardiac arrest. It didn't meet any inclusion criteria, which probably means that it's lacking something significant, and it's not picking it up as a cardiac arrest in your system. And that's also something that needs to be fixed. It won't show up on the report as a validation issue. It's just not going to show up at all. And that's super, super important, because that does happen. And then also just looking at the overall data quality score and range of where the scores fall. Can this improve? Where do you want to land? What would your goal be as an agency? And then the next thing is validation issues related to share PEEP data elements. So there's one part of the report that'll show you that it shows the most common issue. It's not necessarily the one that's maybe the highest value issue, but it's the most common issue based on those specific shared data elements. So kind of in frequency of, sometimes it's every single report that's missing something. And once again, it could just be that it's not being sent to us. In the end, this is a measurement of the data we get, because that's the data that's going to be used for the share registry. So if you're collecting it and we don't get it, it's as if you're not collecting it as far as being able to be useful to that registry. And then there is also a section where it gives specific incident numbers for each issue that occurred, and each issue that occurred for each incident number. And the reason that is important is they can take that and they can look at an actual incident to troubleshoot, go into that incident in their system, and then say, hey, this isn't what this says. What it's giving me as a warning, I have this information. And that's exactly where we can target it. And a lot of times, like I said, if you fix that one issue, a lot of times it's fixed from there forward. And there's many other things that I can work with agencies on. If they would like to meet with me, we can look at, maybe there is a way for you to pull who created the report. Perhaps there's an individual that doesn't realize that this documentation is necessary in this part. It could be many different factors. And then I won't go over the guide, but I just wanted to let you know when I show you the report in a moment, that there is a companion guide available, call it a supplemental guide. There's a link in this presentation, and it will take you directly to the ADHS Bureau's website, to the AZ Peers page, and then to the educational tools. And if you want to pull it up, you can. I don't want to mess up you can pull it up at the end too. But it shows everything from some of the stuff I just went over, and it includes very, very specific information on how that inclusion criteria population is built, so that any agency should be able to take that information in whatever system they use and replicate what we're seeing, what we're using on our side. And once again, if you see a difference, then that probably means that something isn't coming over correctly. Okay, next slide, please. Okay, so 3 parts of the report. The first one I mentioned, total number of cardiac arrests. We have our PEEP EMS department. That would obviously be an actual agency name, but we aren't sharing an actual agency with this right now. And so it gives just some notes. It kind of indicates if there's a 0, that means you don't have any cardiac arrests last month, or we don't have those cardiac arrests. Either, like I said, they weren't sent to us, or if they're not meeting the inclusion criteria. And once again, if 12 looks low, I would love to be able to help address that, because it's super important for us to be able to get every possible cardiac arrest and the complete information in. It's such an incredibly useful database, and it's made such a difference in people's lives. So as you can see with this example, it shows the median score, which everybody's probably used from their other reports. It also has the average score, just because even though that's not part of the PEEP requirement, it's not the average, it's the median that we use. that average helps tell you when there's something way out of sync. One of those is really pulling it down. You know, there might be a whole bunch that are really good, and then you see there's 4 in the range between 60 and 79 validation score, 4 EPCRs that fall in that range for cardiac arrest. One of those might be really low. It might be a 60, and maybe it's pulling down that average, and that might be the one that is the most useful to look at and see kind of what's going on with that, what's really, you know, hitting. Maybe somebody's filling out as a cardiac arrest and then it isn't, so everything else is left blank. And next slide, please. Okay, this is the second part of the report. This is the one I mentioned where it just targets the shared data elements. It's similar to what most agencies receive, something exactly like this, but covering all of their EPCRs and all of, you know, any issues. This is just the shared data elements. And so it lists in order of the most violated rules. So remember, we had 12 incidents in this case, right, for this sample report. So 8 incidences had a problem with Rule 1932. It doesn't say which ones, and we'll get to that in a minute. 2 had an issue with the next one down, and then 1, and then 1. It also gives us a point value, but it also can help you kind of see that it's possible that each run had 1, but it's more than likely that 1 EPCR has all of these problems and 1 EPCR or 2 don't have any problems. So that's what the next, if you could go to the next slide, please. Okay. So the last part of the report, the section 3, is the one with the particular incident numbers. And I chose incident number. I'm happy if an agency would prefer the response number, the EPCR number. I can work with you I can see if I can add it, or maybe I can do a separate one, because I want to give you the number that assists you with finding these. And if you can use the incident number, that's great. But if you need something else, I'm happy to work with you. But these are sorted by this agency. It's sorted by incident number. And then within that, it shows what rule or rules were triggered in that particular cardiac arrest incident for those specific shared data elements. So you can see the first one, it's just got that one. Second one's just got that one. But if you look at the last part, and this is just the SNP, these are usually a little longer, especially the first ones are going to be until some of the stuff gets corrected. Then hopefully we'll have blank reports, you know, forever, because everyone will have perfect data. That's the goal. But you can see on the last one there that ends in 595 that it's got 2 issues. So 2 different things that were triggered on this. Okay, and next slide. That's it. That's all I've got. If we want to click on, can you click on that link in the earlier slide just so I can show everybody where that data quality document is?
I think we'll probably, in the interest of time, because we do have the award, we will send the slide deck out, which does have the hyperlink to that.
Okay, great. And at the bottom of each report, I've now added a hyperlink too, so it's directly accessible from each report. So that'll be there also. Thank you.
Thank you. So if you have any questions regarding anything data related, Anne is the expert. Please reach out to her. Every time I go to a national conference, someone will come up to me and say, do you know Anne Vosbrink? She is well known and kind of the expert in anything image trend and data related. She can help you troubleshoot anything that your agency is having issues with. And she's really a wealth of information and has been for a very long time with the Bureau. So please reach out to her with any questions regarding this, and she'll be happy to help. All right. Next, we are going to start the presentation of the EMCT of the Year Awards. So I think it's I don't know, Julia or David, who is kicking this off here. We can go ahead and maybe do the one slide that has the awardees.
Yeah, I can just
So, sorry.
Yeah, well, thank you so much for coming today. We are going to award our EMCT of the Year award. This is our 3rd year doing this initiative project, and it's really fun to be able to recognize EMCTs from each of the regions as part of this. So today we'll have a regional council representative present each of the awards on behalf of the Bureau and the region. So here are the winners. Congratulations to each of you, and I will, we can go ahead and start with the Northern region for Vince.
That is not being projected on the meeting. Sorry, just before if we could.
You want
Oh, that's fine. If we're gonna do the word use, we can do that. Okay. Okay.
Do it the same place.
We'll do it right here. That'll work. Thank you.
Yeah, sure. Appreciate this.
You can either hold my phone or I could be your audio for you, whichever you prefer.
Northern Arizona EMS Council would like to acknowledge that Matt Shaw has received our full unanimous support as a representative to receive this prestigious award. I'm not going to read the letter. I think I can just tell it how it is. Matt is a battalion chief, paramedic at Guardian Medical Transport, and he is not an ever-present person at these state council meetings, always representing paramedics in the rural and wilderness areas, ensuring that our practice and scope of work that we do is well represented. And he's always at these state meetings looking out for us. And he's our resident researcher. He has quite a few publications and some prestigious journals, as well as he's presented at some national conferences and well published and acknowledged. And just from the high performing leadership part of that, he has done a tremendous job just leading his team in EMS operations, ensuring that they have all the tools they need to do their job. And so for a lot of just outstanding reasons, would like to acknowledge Matt Shaw as the EMCT for BEMSTS. Thank you.
Woo! Congrats, Matt.
Vince. All right. We went out of order a little bit here on the screen. Dr. Gamer, are you giving the Central Region one? Come on up. There you go.
So we have Lewis. Lewis, please come up. Paramedic Lewis D'Angelo. I will go on script here because this was an award from the entire Medical Services Division. Candidacy was put forth by the entire Medical Services Division from Surprise Fire Medical. I'm very honored as chair of AIMS, the Central Arizona region, to present this award to Captain D'Angelo. And I do want to read what was put forth by Chief Larry Suburbi at Surprise Fire Medical and the entire Medical Services Division. Captain Paramedic Lewis D'Angelo is the model for what an Arizona paramedic should be and embodies the motto and mission of the Surprise Fire Medical Department. Always there, always ready. Captain D'Angelo has been a member of the Surprise Fire Medical Department for 18 years. I've personally been Captain D'Angelo's administrative medical director for 16 years of that time. And it's been a great ride. Captain D'Angelo has tirelessly pulled double duty as a staff member of the Medical Services Division, and in his current position as captain in the Emergency Medical Services Division, the department is making great strides in the expansion of the SFMD training program to include a robust training calendar enabling all of the Surprise Fire Medical Department EMTs and paramedics to get enough training in-house to maintain state and national registry certification. His expertise includes RSI, TBI, drowning, mass casualty, trauma triage, and treatment, as well as many other assessment, treatment, and systems issues. I think Lewis knows more about ketamine than most pharmacists or anesthesiologists. But he uses a case-based approach to ease the training process of the trainees in each of his classes. He helped create a program called First Fridays with Fire open to the public and instructing the public and City of Surprise staff members on CPR, stop the bleed, AED use, and nasal naloxone administration. I want to say, go off script here. Captain D'Angelo is a great winner this year, but I think any year he would be a great candidate. But this particular year, the field performance of Captain D'Angelo exceeded expectations, but especially on May 17th of 2024. Captain Louis D'Angelo's crew was the first EMS crew on the scene of a shooting call in our city. This call was very high stress as the shooter was barricaded in a home after shooting the victim, who was a 7-month-old baby. Captain D'Angelo did not hesitate to enter the hot zone to get the patient out of harm's way, fully knowing the risks involved with entering a hot zone. Captain D'Angelo's ability to assess the scene and get the patient to a safe zone while managing the crew's safety and tending to a critical patient is unmatched. Captain D'Angelo was very calm and collected despite the chaos that was going on during this scene. Due to his and his crew's skills, this baby is alive today to continue their life to the best of their ability, despite that dreadful day. This crew's swift action and care undoubtedly assisted in saving this child's life. Phoenix Children's Hospital has recognized Captain Paramedic D'Angelo and his crew, as well as Banner Air, for this call by honoring them for their acts of bravery on this dreadful day with a PCH challenge coin, a very high honor. Challenge coins have been used to symbolize one's emergency service, exemplary service. I cannot think of a better situation that can symbolize Louis D'Angelo's exemplary service to our city, our citizens and visitors, as well as the City of Surprise Fire Medical Department. In short, because of his past and future service to our agency and the citizens and visitors to the state of Arizona, there can be no better candidate for EMCT of the year than Captain Paramedic Louis D'Angelo. Thank you.
And at the end, we will get all the awardees together for some pictures. So we'll definitely have some time at the end for that as well. Next from the Southeast region, from Sames.
Excellent. I'm going to hand you your plaque. There you go. On behalf of the SAMES, or Southern Arizona EMS region, it's my pleasure to recognize our EMCT of the year from Southern Arizona, Paramedic Michelle Robbins. I'm going to tell you a little bit about Paramedic Robbins and the amazing stuff she does in Southern Arizona, all thanks to Chief Savage from Fry Fire, who did do her nomination. So credit where credit is due. Thank you, Chief Savage, for the amazing nomination. Michelle's a relatively new paramedic in our region. However, despite only working as a paramedic for a little bit of time, she has performed with confidence and really risen above and beyond the role of a paramedic to serve her community. I just want to highlight one example of that outstanding work. In February of 2024, Paramedic Robbins received the David R. Deary, did I say that right? Unit citation for life-saving actions taken on a call. And this is a really cool call. I'm going to nerd out on the medicine for a second. Give me a minute. It was a rat poisoning overdose. So for those of you that don't know about rat poisoning, it's like super Coumadin. It thins out your blood. From a medical perspective, it's a nightmare, right? They're truly difficult patients to work with. So Paramedic Robbins had a rat poisoning overdose. She did all the right things. Called poison control as the patient deteriorated, called for online medical direction, talked through the patient, talked about rapid sequence intubation, did RSI, successfully secured the airway, amazing work, and then continued to transport that patient on event to the hospital. The patient spent several days in the ICU and had a great outcome, I understand. So congratulations. Just one example of her amazing work. And that's, of course, not all. Just like all of the other award winners today, she's gone above and beyond at all the day-to-day things that have to happen, as you all know, to run an EMS agency. Is a leader in education, is a leader in clinical care, has really become the example for all of the rest of the paramedics and EMTs in her community to follow, and follow in your footsteps and become the outstanding medic that she is. So with that, congratulations, well deserved. Thank you for all your service to our community.
All right, thank you.
Here you are. All right. On behalf of the Western region, we are proud to present the EMCT of the Year Award to Megan Husted. She is the definition of a go-getter and above and beyond type individual. Personally, I've known her for about 8 years now. I've seen her grow in the EMS service in our entire region. She's very well liked and respected. I've had the opportunity also to see her in paramedic school grow from that standpoint. She's already a supervisor with AMR, which is also very impressive. And she really does, and she really is the very definition of a true leader. And we all have that person in our agency. Once that one walks in the room, the atmosphere changes in a positive way. She is that. So you represent our region well. We are very proud to congratulate you on the EMCT of the Year Award. Congratulations.
Congratulations. Congratulations.
All right. So congratulations to all our awardees, and a big thank you to our regional councils who took the time to get the nominations, review all of them, and then decide who the awardees would be. This is really something, this is, as Julie had mentioned, our third year doing these awards, and it's just a very different feeling from the Bureau perspective. It's a chance for us to recognize the work that's being done out there by all of you to save lives across the state of Arizona. And so a big thank you to everyone, to all our awardees, and congratulations again. All right, next we are going to move to our Standing Committee and Regional Council reports. Dr. Merrill, I see you on the line for a TEPI update.
Yep, thanks for having me. From our March meeting, our TEPI meeting, we approved the minutes. Similar to today, Adam shared what they're working on with the share dashboard and automating the data. We received a presentation from Kim on verification trends and understanding ACS exit scores, similar to a presentation that was at STAB in January. And then we moved to approve changes to the member roster, and that will be updated showing the vacancies. And that's my update.
All right, thank you. Next, Brian for education.
Thank you.
Oh, 1 second, Brian, sorry. Thank you.
Do you want me to get closer to that thing? All right, thank you. At our March education meeting, we approved the minutes as presented. Dr. Dan shared the pass-fail rates. There was attendee discussion on the gaps in the rules for oversight on testing. There was going to be a presentation on some training for children and youth with special health care needs. That was not completed. We're going to be having our 4th meeting soon to try and complete that and have that for the next go around. We approved forming a work group to make STR training modules. They met on April 25th, and they're going to be working on a draft RSI training for the July agenda for approval. There were no work groups formed on review of the training list of things that are on for review and for upcoming stuff that we're looking at.
Thank you.
PMD, we approved our minutes as presented. We approved adding oxygen to the EMR column and drug table 1. That will go to Medical Direction Commission today. We discussed optional drug minimums on table 1, and we had decided to revisit that in July. That will, however, be going to MDC today. Discussed adding drug profiles to table 1, and probably won't add any profiles unless they are added into the TTGs. So I think most of the rest of them are done, except for I think we had looked at some of the critical care paramedic drugs, and it was decided that they were probably going to get enough of that in their program that we didn't need to pursue that.
All right, thank you, Brian. All right, next we will do the regional EMS council reports. Roy, I believe you are online for the Central Region report.
I am Dr. Bradley. Thank you. First, I'd like to congratulate all of the EMCT of the Year awards, well deserved, and I couldn't pick a better group of people to be honored. Secondly, on the interest of time, I'll refer everyone to the report from the Central Region on our activities over the last month. As you can see, we've been very busy, and I'd like to have special emphasis placed on the EMS Odyssey Conference coming up June 12th, 2025. There'll be 6 hours of CE available for EMCTs and RNs, and we have some exciting speakers. The keynote's going to be on the EMS evolution and rise of artificial intelligence in the EMS. This speaker is nationally recognized, published, and should be an exciting presentation, as well as many other fine presentations. So I'll refer you to our Central Region report. Thank you.
Thank you, Roy. Next, Sarah for SAMES report.
Good morning. Thank you, Dr. Bradley. We won't have a written report for this one, but we'll on the next one specifically because we are still in the process of our chair re-elections, and many of our initiatives and activities are pending that result. However, I do want to specifically call out Dr. Gaither for being there to present our award to paramedic Michelle Robbins. We are so fortunate to have her in our region, and it makes it even more special that Dr. Gaither is working with her also at the U of A in her capacity there. And then finally, I want to call out Chief Savage for his leadership and making sure that he highlighted Michelle's significant accomplishments throughout the year, as well as what her life and her professional career look like going forward. And to that end, Chief Savage also put Michelle forward for the Chuck Kramer Award, and she received that scholarship and award from us as well. And it just shows that our contribution to financial commitment to training and education for paramedics in the region results in paramedics like Michelle, who are doing great work within our community. So I just want to thank both of them again.
All right, thank you, Sarah. All right, next for names report.
I feel bad that you have to walk over the place. Good morning. Just from the names area, would like to talk about our 16th annual Arizona Pediatric Symposium. The event occurred in March, and it was very successful. We had some great feedback from the attendants, and we're getting ready for next year. So this is the first year that we actually had a positive revenue balance. Good, in light of the up and coming funding shortages. But would really like to thank the vendor sponsors for their support. It made a huge impact this year. Otherwise, I'll defer to the remainder of the report as submitted. Thank you.
All right, thanks, Ben. All right, and then Rod for the Western Region report.
Good morning. Our last meeting was January 3rd in Parker. Our next meeting is next week on the 15th in Lake Havasu City. We are almost completed with our provider assistance program for this year. And we have a DECO class coming up in October in Kingman, DECO standing for designated infection control officer. And it was a reminder, every EMS agency is required to have a designated infection control officer to manage exposures should they occur. And that will be in October as I said, in Kingman. And that's all I have.
All right, thank you. Next, I'll call it over to Abriana for PACES update.
Good morning. So for PACES, minutes were approved as presented. We did host 2 speakers, one being within the Department of Health Services, where they're looking to connect hospitals and EMS with resources for congenital syphilis testing. So if you're interested in that, we would value the partnership regarding that. We also had a presentation from the Trust Alliance, which is seeking to unify EMS trauma hospitals and schools in developing their emergency operation plans. And so if you're interested in that, please let me know. In addition to that, PACES committee met and approved the expansion of membership within the bylaws to be more inclusive of individuals serving in pediatric leadership roles. Some of those roles include an Arizona Ambulance Association representative, pediatric emergency care coordinator in both the emergency department and EMS agency, a representative from a hospital with a trauma program, an at-large EMS representative, a pre-hospital hospital coordinator, public member, and a representative from a tribal community. If anyone believes that they would fulfill that role or know of somebody interested, please send an email to myself with a letter of interest as well as your resume or CV. In addition to that, the PACES committee did meet and approve the recognition of those 6 EMS agencies that we mentioned earlier. Again, I just want to emphasize the effort of those agencies and thank you, EMS Council, for approving that program to follow through as it recognizes those that are doing the pediatric excellence and emergency care for our state of Arizona. And then lastly, the Education Committee and PACES Committee are hosting a joint work group to develop children and youth with special healthcare needs training for EMS providers. We are looking to have our final meeting on June 2nd. So if you are interested in that, please send me an email and I'll happily add you to the invitation. The next PACES Committee meeting will be on July 10th at 1:30 p.m. Thank you.
Thank you. Next, we will move to our discussion and action items. First up is the meeting minutes from January 30th. Can I get a motion to discuss, amend, and approve the meeting minutes from January 30th?
Second.
All right, first from Dr. Madem, second from Brian Smith. Thank you. All right. Any recommended amendments to the minutes? Hearing none. Any opposed, say nay. Any abstentions? All those in favor, say aye.
Aye.
Aye. All right. Minutes are approved. Thank you. Next, I'm going to turn it over to Likia, who's going to cover some updates regarding our critical care endorsement. We'll pull up the slides in just a second here.
Good morning, everyone. So just quick updates about the critical care endorsement. Right now, everyone in the state, since this is like the first time we're doing this endorsement, everyone has to submit their initial endorsement application, which is really simple. The system automatically is going to populate your demographic information. You just pretty much need to have a copy of your certificate to upload into the system. After that, you just need to complete your criminal conviction questions, and then just do the attestation and submit the certificate, the endorsement. Pretty much it's like I said, really simple. If you have any questions, just let us know. In here we have some of the requirements. So if you're not a paramedic, you won't have access to the application. We have set up the system that way, so it's only available to the paramedics. The contact hours are listed in here, and then we use the international, let me pull up the name, the International Board of Specialty Certifications to verify the endorsements. So if you have any questions, just let us know. And then for as far as the recertification, we're working on that as well. We're trying to make it as simple as possible. So we'll have a section in the renewal applications that will be just if you will be able to see it only if you have the criminal. Sorry, not the criminal, a critical care endorsement. That window is going to pop up with you, and then that way you'll be able to a test, and then you'll be able to upload your certificate information. And then the last slide, Shelley. So far, we've had 366 approved critical care endorsements since we went live back in January.
Thank you, Lahia. Really, again, a big thank you to our MDC members who really took a lot of time with PMD to go through the whole process of approving kind of what the scope of practice drug tables look like. And then our education committee who helped extensively under Dr. Rice with working with the stakeholders to look at those rules for certification and developing this process. I think the fact that we now, in just the first 4 months in 2025, have already approved 366 critical care endorsed paramedics in the state. This is a huge win. This really allows us to improve the amount of resources, especially when we look at some of those critical care transfers. We know that this has been a big ask in the state for many years with the limited number of nurses available. And so now we have an actual certification for critical care endorsement, which also allows agencies to bill at a higher rate for that as well. So this was a big, I think, win for the state of Arizona, for EMS agencies. And really our hope is that this also grows the workforce. We understand that for many paramedics, they may get to a point in their career where they no longer want to run a call at 2 in the morning on the side of the road. But this gives them more options to do a higher level and more advanced care. And so this is that kind of career growth pattern that we're really excited to support. So thank you to all of our committees that helped support this process. It was a big road over 2024, going through all those different meetings and getting things forward. So thank you for everyone who participated, and congratulations to all of those that have gotten approved already. Yes, Dr. Gamer?
Might go back one slide. So current national certification, that means that they have to maintain registry for the certified? Or
That's for the
is-
certifying exam. Yeah.
Oh,
For the critical care exam.
okay.
Yes.
So they don't have to maintain registry paramedics or.
No, that's separate.
Okay. Thank you.
Yes, absolutely. Any other questions? Thank you. If there's any agenda items you would like to be considered for the next meeting, please send that to either myself or Shelley Bissell. I will open up to call to the public.
Thank you, Dr. Bradley. I just wanted to get a conference on everybody's radar screen. It's the Citizen CPR Foundation Cardiac Arrest Survival Summit that's going to be held at Arizona Grand Resort in Phoenix, December 2nd through the 6th. The 2nd and 3rd are pre-conference sessions, the 4th, 5th, and 6th, Thursday through Saturday, the main plenary sessions of the conference. This is a biannual conference. It's going to be a pretty big conference. They want 1,000 attendees. I'm the co-chair of the local planning committee, and if you're interested in participating in any way with survivor stories, with projects that might be suitable for poster board presentations, that sort of thing, please contact me and I'll get you to the proper conference planners. You can contact me by email, garth.gamer@phoenix.gov. Also, one of the things about this conference is it's going to be one of the first opportunities for presentation of some newly vetted, ILCOR vetted treatment guidelines that they're currently embargoed, so we don't know much information about them, but I've been promised that there's 13 different guidelines that go across the entire field of resuscitation arts, from pre-hospital, athletic field medicine, emergency department, in-hospital resuscitation, and these aren't going to be entirely CPR guidelines. They're going to be the seconds to minutes illnesses are all going to be taken up in these guidelines. So it should be a tremendous scientific conference. Again, contact me if you're interested in being on the local planning committee, garth.gamer@phoenix.gov. The agenda and fee structure is going to come out in June. and I'll circulate that. Thank you.
Thank you. List of upcoming events is on the agenda. If you're interested, there are a number of conferences coming up over the next 6 months or so. Our next meeting will be scheduled September 18th at 10:30 a.m. The meeting schedule of 2025 is in the packet as well. If I can get a motion to adjourn.
Second.
Thank you. Meeting is adjourned. And again, if all the awardees can come up, we want to make sure we get a picture with everyone. Thank you.